Okay, so my name is Erica Mendez, and my case presentation is about the character Kevin from the movie Split. So, this movie is about three girls that are kidnapped by a man named Kevin who has dissociative identity disorder. And danger is fast approaching for them as Kevin's 24th personality is about to come into the light, meaning that he will become the main um, personality that is being shown. So, Kevin in his childhood, his mother was very abusive towards him because she had OCD and she always punished him whenever he made a mess or didn't do anything that she wanted him to do. And he was later put in care of his father, but his father later abandoned him at a train station and he was sent into foster care for the rest of his childhood. So each personality that he had was created at some significant point in his life. For example, Dennis, who was created first out of defense while Kevin was being abused, and Hedwig, who was created when his father abandoned him. The disorder can be categorized under dissociative disorders, which are described as the disruption of normal consciousness, including memory, identity, emotion, perception, body representation, motor control, and behavior. The symptoms of these disorders have the power to disrupt every area of psychological functioning like behavior, emotion, and overall mental health. Kevin has dissociative identity disorder, which can be described as having two or more distinct personalities and experiencing disruptions in their sense of self, which can even change and become altered. To be diagnosed with dissociative identity disorder, or DID for short, one must have two or more personality states that are distinct, recurring gaps in memory, significant impairment in everyday life caused by the symptoms of this disorder, abnormal disturbance, and the symptoms cannot be explained by any other effects of substance abuse or some other medical condition. The symptoms for this disorder can include depression, anxiety, substance abuse, self-injury, seizures, amnesia, OCD, paranoia, cognitive disorders, and PTSD. Of these symptoms, Kevin displays three of these very clearly: amnesia, OCD, and PTSD. Every time one of Kevin's personalities came into the light, they had no recollection of what happened before. And two of these personalities very clearly show the presence of OCD. And most people with abusive parents come out of childhood with some form of PTSD as displayed in Kevin. But despite his many symptoms, he seems to not struggle with seizures, which can be present between personalities. In the top left, you have Dennis, who has OCD. He is currently cleaning the dashboard of a car, despite the fact that he is kidnapping three girls at the moment. In the top right, you have Miss Patricia, who gets angry at cutting a sandwich into imperfect halves, so she has to throw them away and start again. On the bottom left, you have Kevin's mother, who represents his PTSD. When you say Kevin's full name, it brings him back into that past, and it also brings Kevin back into the light. So Kevin in the last photo, due to his amnesia, is very confused because the last time he was in the light was 2 years ago. So he has no idea what is happening now, and he has no idea what happened between then and now. Treating someone with DID can involve ongoing treatment therapy with specific goals in mind. Removing abusive environments and adding healthy coping mechanisms can give the patient stability and allow them to function effectively in society. This treatment therapy may take years, but the patient can develop a healthy mental state. An ethical problem that can arise, though, is if a personality tells a therapist that they're going to commit a violent crime. Does that therapist alert the authorities or not? Split did encourage some of the stigma surrounding DID with the fact that it was put in the horror genre. But despite this, the movie did get a few aspects of the disorder right. So all in all, it was a semi-accurate portrayal, with the exception of having to make him into some sort of villain or monster, of course. But most of the movies depicting DID, like this one, increase the stigma of the disorder by portraying it as very violent and dangerous, when in all actuality, the people who have DID are in fact victims.